Hello and good evening, everyone. My name is Dr. Laura Varden. I am Dean of the DNA University and an in-house clinician here at the DNA Company. And tonight, really exciting topic. We are going to be talking about peptides, inflammation, and neurorestoration. And even if you don't know what that word is, you will by the end of this webinar. But I'm sure that you can figure out that we're going to be talking about the brain and brain health. And something I want you to realize that brain health is not static. It's not something that is there when you're born and it's the same way when you die. It is shaped and affected by things like inflammation, hormones, cellular repair pathways. Yes, even your genetics, they influence that. And when we talk about neurorestoration, this is really working with these symptoms and systems, not against them. Did you know that the CDC said that over 80% of adults experience at least one mild TBI, that's traumatic brain injury, in their lifetime, and many go undiagnosed? That leads to chronic inflammation, and chronic inflammation is a major driver of persistent symptoms. And like I had mentioned about genetics influencing how your body, how your brain deals with inflammation, hormones, cellular repair pathways, what we do here at the DNA Company with functional genomics really looks at and answers the question of why do some people recover quickly while others struggle and seem to not repair and recover as quickly as their counterparts, and they have more fatigue, more depression, more cognitive impairment. Well, that's what we're going to be discussing. And when we talk about neurorestoration, this is what it means. It's reducing inflammation, optimizing hormones, and supporting those repair pathways, such as neurogenesis. What's that? Neurogenesis is the creation of neurons, nerve cells, those cells that help the electrons and the electrical impulses that makes our brain and our bodies work. And it also helps with mitochondrial recovery. And tonight I have the honor and delight of presenting this information and having an incredible conversation with Dr. Mark Gordon. He is the founder of Millennium Health and a highly read and experienced doctor in TBIs, in traumatic brain injury related hormone dysfunction, neuroinflammation, and neurosteroids. And he's also the pioneer of neuroendocrine restoration in the brain and in brain injury. So welcome, Dr. Gordon. So glad that you are joining us today.
Thank you very much. It's really an honor to be here to share the 40 years of my experience in practice in general, and then the last 30 years working in this area of neurotrauma, which is another term for traumatic brain injury. Because as you'll learn as we move forward, it's a misnomer calling everything a traumatic brain injury, because what's implied in traumatic brain injury is that someone has had either a loss of consciousness or migraine develop or visual disturbance, nausea, vomiting, when in a majority of the cases, there's something called subconcussive trauma, where they'll have a little hit, no immediate symptoms, but over the course of time, you'll have a aggregation or an accumulation of this inflammatory process that we'll get into shortly that creates the changes in the biochemistry or the neurochemistry or the chemistry of the brain, such that the normal chemistry that's needed so that you're emotionally stable, you're cognitively able, you're not in a fog zone, that you're able to remember words or remember people's faces or names, that it's denigrated, it's destroyed by having this inflammation. And it's relatively simple to appreciate that when you change the chemistry of an environment that has a very special chemistry, something's got to go wrong. And what goes wrong is that electrical conductivity that you talked about, the electrons flowing. Everything in our brain and our body is a circuit with electricity running through it. And if we alter that electricity, you lose functionality. It's like having a flashlight and the battery goes dead. How
Mhm.
much brightness are you going to get off the light bulb? You're not going to get very much of it. So
Yeah.
the portion of what I do is number one, education. It's extremely important to correct a lot of the misnomers and the fallacies that have been given to us over many years. There are areas that happened recently that we learned that we were lied to. Well, science is moving forward. We're learning, and therefore, in teaching our patients as well as educating our healthcare providers who are interested in learning more about what it is that we've experienced over the past 30 years in helping people in the NFL, NHL, football, hockey, motocross, civilians, and so forth, what it is that we've found that works. So, our overall mission is education. Number two is to honestly define why someone develops a neuropsychiatric condition. Neuropsychiatric condition is like depression, anxiety, bipolar, obsessive compulsive. You weren't born to develop depression or anxiety in the majority of cases. They're the outcome of having disruption in that neurochemistry in the brain. So, what we do is we objectively, which means that we look for cause and effect, we look for markers, we look for chemistry, we look for telltale signs that attribute or can be attributed to why you develop psychiatric conditions, and not just sitting with a doctor who says, "Oh, you're depressed," and you turn around and says, "How can you prove that?" And they say, "Well, my experience, you're depressed." Well, what we can actually do is we can show the biochemistry, the difference in the neurochemistry of the brain, and how it predisposes you to these certain conditions. So, as I said, education, objective, and then treatment. Treatment for us is not a long life or the entire life. It's about you see a hole in the street, you fill it in, you're done until the hole happens again. So we have people that we have taken care of over a period of time, 3 months, 6 months, 9 months, 12 months, 18 months. They've gotten better. And then 5 years later, they come back. Why? They had a subsequent injury. But during that time frame that they left us, they graduated, they just need to do the right things for themselves, is what we'll talk about later on, which is lifestyle choices, choosing the
Right.
right things that influence why some people will have symptoms exposed to the same trauma and other people will not. Now, I work is
No, well, I was going to say, and also knowing their DNA, knowing the blueprint they have to work with, and understanding where their weaknesses are, because a lot of trauma inflammation, it does come down to how well are you clearing it, how well is your body responding to it, and having that information can help even more in the precision of being able to help shift them out of that neuroinflammatory state, to fill in that pothole and move them forward, but also in the prevention, like you were talking about, knowing, okay, I need to support these particular pathways. I have to be careful of this. I need to be even more mindful of a certain events or exposures to toxins or to hitting your head. And that's something else that I wanted to mention because, yeah, I mean, I talked about TBIs, traumatic brain injuries. That seems very event like situated where, for example, you work with post traumatic syndrome and post TBI military. Okay, so that's like a definitive event. And there's also uh, athletes, football players, hockey, anything, soccer, headbutting the ball, anything like that, that can cause a trauma to the brain. I mean, I'll tell you what, I was a professional figure skater. I also ran track and high jump, long jump, all these things. I can't even begin to count how many times I hit my head And some of the issues in long term, it's like we didn't really understand or know that back then.
Hmm.
I mean, granted, I've had Bell's palsy 3 times. Could that have been a precursor that was that perpetrated me to have this issue, along with possibly other things? But I mean, I have a nephew that played football. I was scared to death because I knew about TBIs and the issues at the time. My grandson plays hockey. I was at a game where he slid into the wall and hit his head, and he was a bit out of it. This is a more of a regular occurrence than people think, and this is exactly why that CDC stat of over 80% have it. Yeah, and this can affect that inflammatory state. This can affect behaviors. This can really do all of these things. And I'm so glad that you are here to be able to give information on protocol types, on peptides that you use. Before we dive into that, I would love to bring up the poll questions to see what our audience has to say about some of the questions we asked. All right, let's get this to where I can see it a little better. All right, so wow, we've got a pretty even spattering when it comes to why you all joined us here today. But mainly, almost half of you said that you are curious about peptide therapy. So definitely we are going to be diving in and touching on that. And I'm going to have you speak about some specifics. Next up was interest in neuroinflammation, and then wanting some solutions for brain fog and cognitive recovery. Then, as far as brain related symptoms, which are most relevant to all of you, we really, the fatigue and low motivation, that comes down to ATP production, mitochondrial health, which we're going to be talking about. So that was followed up. Memory issues, low mood, anxiety, brain fog. These are all symptoms that oftentimes come together. Don't you think, Dr. Gordon?
Absolutely. The issue with neuroinflammation, if I may,
Mhm.
is probably one of the most um, impacting on all the functionality that's listed in here: brain fog, low mood, anxiety, memory issues, libido, motivation. It's all related. And how it all relates is because neuroinflammation, what that is when there's a trauma. Let's talk about subconcussive or repetitive head injury where you don't have loss of consciousness. You have little tags that happen like heading the ball, okay? Heading the ball, which is illegal, what, less than 18 in the UK, and in the United States, I think it's 14, about heading the ball. But what happens is something called mechano translation, where from the impact, the cells in the brain vibrate together. And in that process, they release inflammatory processes or chemicals that are called free radicals. And those free radicals that we, take vitamin C for, fish oil, N-acetylcysteine, we take a lot of things to try and reduce the oxidative load in our brain, because what it does is it turns on a cell in our brain they call microglia, which releases these inflammatory chemicals called cytokines. Those chemicals interrupt the chemistry of the brain that allows you to be great mood, high energy. It interrupts the mitochondria, so you have mitochondrial dysfunction, which are responsible for making the ATP the energy of our body. If you have low energy, like that analogy with the flashlight, your batteries are going down or burning out, your light goes from bright to dull yellow and then off to blackness. And that's what happens to the mitochondria, the energy manufacturing centers in every cell. So this inflammation leads to something else. It shuts off the main circuitry in an area of the brain called the hypothalamus, which controls your hormones, all your hormones. And without the proper production of hormones, you get depression, greater inflammation, you get issues with libido, you get issues with assertiveness, competitiveness, memory, recall, the ability to learn new things, because it influences a multitude of areas around the brain. In the psych world, they talk about this area of the brain called the limbic system, which is your emotional center. On the outside of it is another area called the amygdala. Well, if you don't have adequate amount of hormones, which in the brain are called neurosteroids, nerve steroids, hormones, which are all generated by cholesterol. If we mess with our cholesterol, what happens is you have death of your mother from statins, as my mother died from statin dementia, because the brain is 25 to 35% or 30% cholesterol and is responsible for neurons communicating,
Mhm.
axons, and so forth. So, what happens from the neuroinflammation is you disrupt these chemical pathways that help with memory, that interrupt the ability of the brain to take cholesterol and make it into estrogen, progesterone, testosterone, and so forth, as well as the inflammation in the brain kills growth hormone first, testosterone, estrogen second, thyroid third, and cortisol fourth. And it's in the literature that's very clear from trauma. And the biggest issue is you have an insult to your brain and you don't recognize it as an insult because it didn't put you on the ground.
Yeah, I'll tell you, that's why it's really nice to see how many people here, almost 70%, are taking some sort of nutraceuticals like omega-3s, curcumin, to help reduce that inflammation, magnesium, all these things for brain support. That, because you had mentioned about, using those things, that's a start. And, for the people, actually it's very interesting that we've got almost 30% of the people saying that they've used peptides. It'd be interesting to see which peptide therapy you've used. Put it in the chat, which ones that you've used if you have used them in the past. But we've got people researching, people who have just heard about it, and 20% who are new to it. So hopefully they'll learn some and will incite their curiosity to learn more. I'm seeing in the chat like BPC 157, GLP-1s, Selenk, let's see, ARA 292. So yeah, so we've got CMAX, yeah. Let's see, Sermorelin. What's the other one? VIP. I'm not familiar with that one.
Times, yeah, times
TB, yeah,
beta
yeah.
4. Yeah.
TB 500, yeah. Excellent. And, really, when we are talking about being diagnosed with chronic inflammation or some sort of inflammatory condition, we've got almost, not quite half who said, yeah, I have been. Thankfully, those that said no, but for that 21% who's saying, well, not formally diagnosed, but they suspect, even understanding what could be going on symptomologically and finding someone to talk to see, to get you on a path to help lower that inflammation, to understand the way that your pathways work, so that way you don't have to suspect anymore and you can take preventative measures. Thank you so much, everyone, for filling out the poll and for the wonderful information so far, Dr. Gordon. Yeah, we've got others, SS31, MOTC. Yeah, so wonderful. Thank you. So let's dive in a little bit more
Okay.
when we are talking about neuroinflammation and some of the functional genomics. I'll pipe in with some information there, but I would love to hear more about brain injuries and how maybe even chronic stress, toxins, infections, all of these things can affect that neural inflammatory signaling, and what's going on there.
Absolutely. Um, One of the reasons why I don't believe in PTSD, which is theoretically a 100% psychiatric condition, is because in the large population we have of over 12,000 individuals, that those who were the military who have been given the title of having PTSD, every single one of them had a trauma. whether or not it
Mhm.
was prior to enlistment in the military or during enlistment in the military with explosions, IEDs, repetitive gunfire, mortar fire, tank fire, whatever. And the effect of uh, these weapons, these blast traumas, are a physical wave of trauma. But what about those people who have never been exposed to that, but they've got chronic stress? How is it that people with chronic stress develop a lot of the symptomatology, the symptoms that we see in people who have been exposed to blast wave? And the reason is because of two hormones. One is called cortisol, the stress hormone. It turns out that the stress hormone cortisol causes an important chemical in the brain produced by neurons called fractalkine. It causes fractalkine to decrease. And what's the purpose of fractalkine? Fractalkine protects the brain from excessive production of pro-inflammatory chemistry cytokines that we talked about. So when you're under stress, no physical trauma, just stress. What happens is fractalkine drops and your microglia, the cells of the immune system in the brain, start releasing a lot of inflammatory chemistry. That inflammation causes destruction of a lot of the systems, the chemical systems in the brain, enzymes, protein, receptors that are important for recognizing neurotransmitters. It destroys neurotransmitters. So, this is how someone who has no physical trauma can end up having a lot of the same symptoms as someone who has had physical trauma. And it's only been 8, 9 years that this fractalkine relationship has been picked up. And when I read it, it made sense that that was the cause for people having what they called PTSD. For me, PTSD is a missed opportunity to have treated a traumatic brain injury or a subconcussive trauma. So I'm not very well liked in the PTSD forums, but they can't refute the science that exists. They just refuse because it's easier to give pills out than it is to do the testing to prove that something is or isn't there. In the mental health world, it's usually because of my experience, I can say you've got depression or you've got anxiety or bipolar. But in my world, it's all science that has to show the cause and effect. Showing a DNA panel that shows that you're unable to metabolize B vitamins, which creates a lot of problems in psychological functioning and gut functioning throughout the entire body.
Right. When you talk about the methylation pathway, it's not just about the MTHFR gene, as you were saying, with your B vitamins, especially when you're talking about, B9, B12, cobalamin, how well is that being transported from the
Mhm.
gut to the bloodstream to then be useful for DNA synthesis, red cell production, all of the other things that it does. But just within methylation itself, that's needed to make and recycle the neurotransmitters, serotonin, dopamine, metabolize those sex hormones, estrogen, the stress hormones that you were
Mhm.
talking about. And, if someone has a slower variant or a dysregulated pathway, that really can lead to lower methyl donors, the higher homocysteine, that inflammatory marker that thankfully can be measured so you can see how well that methylation or where they might need support. And it when you're talking about inefficient neurotransmitter hormone or hormone processing, that directly, just as you were saying, shows up as that mood instability, poor stress tolerance, sleep problems, because a lot of people with PTSD that I have researched and found and have spoken to directly, their sleep, the insomnia or the disruption in sleep is horrible, and that really is a foundational aspect for repair, is that quality sleep.
One
So
peptide, one neurosteroid represents that, pregnenolone. Pregnenolone, because it becomes progesterone, becomes allopregnanolone. in 100% of our veterans with insomnia, they
Mhm.
have a deficiency of pregnenolone, okay? Or in the first quartile, in the lowest range. And that's one of the issues. Released a paper recently, the fallacy of laboratory reference ranges. Because if you have a reference range of 10 to 90 and you come in at 11, conventional healthcare providers will say, what? You're normal. And you
Right.
go, but doctor, I have all these symptoms. And they say, well, you're depressed as the comeback for it. But every one of us has a unique level of every one of the chemicals and hormones in our body that you need. I might not need it, but you need it because you're a unique individual. And the standard has been what they call a population-based assessment. They look at a large population, 1,000 people, and they look at what the range is, two standard deviations, 95% of the range, and they say, oh, that is normal, but it has nothing to do with optimal health.
Right.
Nothing to do with optimal health. So, as an aside, you need to look at your chemistry you have, and hopefully, your doctor knows that at the midpoint to 75, 50 to 75% is the optimal, appears to be the optimal functioning range, not at the lower 25% that I see day in and day out. That's read off as normal.
And it's really interesting because there is constantly research being done, about analyzing these brain injuries. Like there was a review that came out in March of this year, and it was analyzing how TBI disrupts pituitary hormone regulation. And it had found that 40% of moderate severe TBI cases develop chronic hormone deficiencies, just like you were saying. This is in literature, and it's a matter of, the doctors and these physicians that are helping these people to read up, to know what is current, what's going on, the findings, because you're really talking about, hormone disruption is not a side effect. You're saying that it is the core driver. And that's what this paper has found. It's a core driver of poor recovery. Um,
Correct.
so, talking about recovery, because a lot of people said in the poll that they want to know more about the peptides. So, let's dive into that. So, would you please explain what a peptide is? And then let's just talk about relevant peptides that you use in your practice, what you have found, what they work for, how, the efficacy of them, etc.
That's a broad spectrum there.
I know. Let's
Pep-
start off. Let's
Peptides.
first
Well,
explain
let
what is a
me let
peptide.
me interject that if your
Okay.
hormones are not optimized, peptides do not work as well. Period. Okay? And talking about your article from March of this year, major article came out almost 10 years ago, which looked at hormone disruption in people who had mild traumatic brain injury. And they found that 56% of the people who had a mild traumatic brain injury, by 3 months, they had 56% had one or multiple hormone deficiencies. And when you looked at 1 year, the chronic phase, it dropped to 36%, which means that 20% of the people spontaneously recovered. So this is an important factor to know, as well as it's important to know that time frame of 3 months. Why? If you have a head trauma today and you do laboratory testing to see if that head trauma today has disrupted your hormones, you might not find that it's disrupted it because you're too early, premature. It can take up to 3 months in order for you to see that. So in our sports people, we'll wait 3 months or 2 months, 10 weeks, 12 weeks before we get a follow up and see that their hormones have dropped. Anyway,
And I want to, I don't mean to interrupt you, but I want to be
you're not.
clear on
We're
that,
having a
as far as
conversation.
it's not that you don't provide them a protocol or help them. It's just that you don't measure or really focus on the change in hormones until 3 months after, because it takes that time for the
Right.
hormone levels to show in
To shift.
tests
Yeah,
how
this
they are shifted.
about 3 months for that shift to be
Yeah,
recognized. Otherwise, you'll miss it. So you do it
right,
today, and it's 3 months down the road that you see it. So
right.
the question is, what are peptides? Peptides are short chains of amino acids. Amino acids are the building block of all our proteins in our system, our enzymes, our proteins. Everything is amino acid. So what a peptide is a chain of three, like GHKCU, which is three amino acids with a copper attached to it. Epithalon, or whatever you want to, how you want to, it's what, 11 or 13 amino acids. And, we have varying lengths. And the craziness of it is that the researchers that have been working on finding these things is by looking at one of our hormones like ACTH, which is adrenal corticotropic hormone that comes from the brain, tells the adrenal glands to make cortisol. Well, they found that there's a little segment of the ACTH that's associated with inflammation that actually improves libido, sex drive in people with loss of sexual functioning, okay, as we get older. They found in other already existing biological, like BPC 157, is a major um, um, body, what is it?
Body
BP,
protection
body
compound.
protective compound. Body protective compound. It's a what? A nanodeco. It's like a large, large protein. And they found a little segment of it
Mhm.
that if you take it by mouth as a capsule, it'll help heal the lining of the stomach. But if you inject it, primary function is it helps with tendon ligament repair. And then it has another level where it helps to reduce inflammation. So, but most people are just looking at it from the standpoint of tendon and ligament repair. And we've had a number of military with rotator cuff, lanubrium in the hip, back problems, finger problems, ankle problems, knee problems. Yesterday, I just injected a doctor's knee with BPC 157 and another peptide, which is thymosin beta 4 or 4
Mhm.
beta 4 or TB 500, and
Mhm.
it's to help regenerate the menisci, the tissue that's in the knee, the what do they call it? The not spacers, the menisci. Okay,
Yeah, or bursa. Well,
the
yeah.
menisci. So it helps to repair that. So these peptides, what they've been looking at, a lot of it research came out of Russia, which is
Mhm.
amazing work that they've done. And there are peptides that address mood, C-Lank, helps with anxiety by resetting the amygdala and the limbic system. Um, N-acetyl Cmax, which is a stimulator of a very important um, peptide in the brain, which is brain-derived neurotrophic factor, which helps neurons to regenerate, neuroregenerative, neurorestorative, and it helps with it. And an aside story is one of my daughter's father-in-law, 76, had a stroke, and he was in the hospital for almost 5 weeks. He left wheelchair dependent. Now, before he went into the hospital with his stroke, we had run his objective laboratory neurosteroids, found deficiencies, but he didn't want to do anything. So I said, fine. But when he had his stroke and left and came home wheelchair dependent, he was ready to try anything. So we corrected his hormones first, and then we put him on to CMAX. 3 weeks later, he's walking without the walker. The rehab nurse came from the hospital to his house to set him up for rehab. She freaked out because he was walking. 3 months after that, he is swimming 20 Olympic sized laps in a pool per week. Okay.
Wow.
Just incredible, just impressive. And then our multiple sclerosis patient, Navy lieutenant who developed multiple sclerosis, put him on to his hormone replacement, got 90% better. That last 10% was putting on CMAX, which helps with the brain derived neurotrophic factor. We've got MOTS-c, which helps with mitochondria. We got the epithalon, which helps with telomerase. Telomerase is an enzyme that helps to elongate something that's on every cell called telomeres. And telomeres are like um, wicks or fuses on a explosive device. So as we go through life, this telomerase or telomere shortens until it's so short the cell dies, apoptosis, it dies. So what we can do now is we can reset it. And there's a major study going on in Russia, in St. Petersburg to be specific, where they're looking at the benefits and they're finding 11 years of extended life in a large population of cohort studies where they're matched age to age, medical to medical, and the group that was placed onto the product lived longer and lived a higher quality of life. So it's called a bioregulatory peptide, which means it regulates our body. Another one that I'm really fascinated with is uh, what is it? The follistatin 344. Follistatin 344 is a peptide which in our body, as we get older, I'll be 73 January, as we get older, we start developing a protein in our blood, which is called myostatin. Myo stands for muscle, statin means to stop. So it causes our muscle growth, repair, recovery to stop. So we lose muscle mass. And as you know, there's a direct correlation between loss of muscle mass and shortening of our life. So they developed this follistatin 344, which blocks this myostatin. So what happens? You can grow muscle and you avoid anasarca. Anasarca is the loss of muscle mass, which is proportionate to loss of life. It decreases your longevity. So I can go on, ARA 290, 292, which is major anti-inflammatory if used correctly with BPC 157. We've got a project that we started. When did we start it? Monday. Yeah, yesterday for psoriatic arthritis because of the flares of psoriatic arthritis. You can drop it because psoriatic arthritis has these spikes in pro-inflammatory cytokines. Rheumatoid arthritis, Crohn's disease, all these autoimmune diseases, Hashimoto's thyroiditis. Selenium helps with the thyroid. Selenium. Um, and anti-inflammation using things like BPC 157 or ARA 292. So there are an incredible amount. I got so enthralled with these peptides. I have a book coming out in December 22nd for physicians first on peptides for health. And then in January, on my 73rd birthday, in January 20th, is the consumer's edition, which goes through 30 key peptides and tells you FDA approval, um, on let's see, off protocol of use, what you should do to medically monitor yourself, laboratory testing. It tells you everything that you need. Off label is what I was looking for. Helps you in what to do, tells you the dosing, the cycling, how long you should be on it and stop, and then if you should recycle on it. So it's really keyed for giving you all the uh, information so you can do it smartly. But find a doctor. Find a doctor who's knowledgeable in this. Read this for yourself, but find a doctor who can dispense the peptides to you. There are a lot. I mean, every day I go through this interviewing peptide companies for those that have legitimate, standardized, approved, pure peptides, because there's a lot of possible poor quality out there, and we don't want that because you start having poor quality out there, the FDA is going to come in and shut them all down, shut us all down. We don't want
We have a question in the chat asking, what's
that.
the name of your consumer book?
The consumer book, it's the same name. It's called Peptides for Health, Consumer Edition, Volume 1. There are 3 volumes coming out every 6 months to a year. I'll be producing a new one because the amount of science that we're getting is just jamming my waves. I can't think anymore. And I've been on a number of the peptides and with great response. I avoided surgery for 16 months on my back. and then, did too much and popped myself over the side where I needed a microsurgical procedure, but not a major one, a little bitty one. My three daughters, two are docs. One of them is using the GSKCU, which is the dermatological one, hair regrowth, improvement in skin. But there are other phenomenal peptides for skin. And the book explains everything. And it also has it's an ebook. So everything you can click and get more information on the internet. And ideal candidate, you click ideal candidate, takes you to 2 pages where it tells you who the ideal person is for that particular peptide, how to cycle it, how to dose it, what to do laboratory to make sure you're okay, and you work with your doctor.
Yeah, that brings me to a question I'm sure a lot of people have. Because I know that a while ago you couldn't get peptides without a prescription. Of
Correct.
course, there's also being very careful about just getting them off the internet because you don't know exactly what
Correct.
you're getting, which is why I'm sure you are vetting these companies. But how does one go about getting them? Are they pretty much all prescription, and in what forms? Because I know the majority of them have been injectables, but I do know like BPC 157 is in oral form. I know some others have come out in oral form. Can you speak into a little bit of that?
Um, the the peptide industry, under the last administration was being attacked, where about 7 to 10 of our key peptides were taken off of formulary. 50, what, 50, 503, 502A, whatever the numbers are. And what's happening now is the FDA is reassessing a lot of the data as we generate the information for them. I mean, no one is doing, pharmaceutical companies generally are not doing the work that physicians are doing because it's like cutting their wrists. I mean, you've got a peptide that will diminish your need for orthopedic surgery. Who's gonna what in the industry is going to volunteer to do that? So what's happening is through translational medicine, which means that we take the peptide and we in our practice um, do the uh, do the assessment, the dosing, cycling, and we monitor them for outcome. Okay. I personally don't sell any peptides. I only sell education. I provide education. I have them go and get wherever they're going to get from whomever they're going to get it from. And there are companies out there, credible companies, who do sell it to everybody. I don't know how long it's going to last. A lot more of the newer peptide companies are privatizing, meaning that in order for you to get access to them, you have to be a member. There are a couple of organizations that are using the scientific research modality, which is called an IRB, Investigational Research Board, so that you come in as part of a study in order for you to get the peptides. And yes,
Right.
there are certain peptides that orally are great, nasally inhaled, like Cmax and Salank, um, the oral form of BPC 157 for gut-related improvement, but injectable for structural related issues. So those are the best ways to get it. So we're in a turbulent time, which is transitioning up, down, left, right, in and out, whatever. So I call my experts. They're the experts. I'm not the experts. I call the experts and say, where are we at on this peptide and so forth. But I don't get involved in buying and selling peptides at this point. Maybe in the future
Well,
when it gets settled.
yeah, well, I'll tell you, the education of it, I think, first and foremost, is the most important.
I agree.
Letting people know what is out there, what it's for, so they can go in and speak to their, prescribing doctor or the physician that is, covering their care, so they can have an educated discussion. One thing I always tell my clients is don't ever give away your agency. You are your own PhD in your body, in your health.
Mhm.
And, be the driver of that bus. Don't let somebody else do it.
Absolutely.
So,
And what we're finding is well, numerically, obviously, the consumer is learning much more than the majority of physicians out there. Okay, because of the controversies with the peptides, a lot of physicians, healthcare providers are not looking at the science behind it. They're not self-educating where the consumers are, and that was the purpose for generating two separate books, one for the doctors and one for the consumer. The consumer is a thicker book because more time was spent explaining things so that explaining it so that it was very, very clear. Okay.
Wow, wonderful. So I know we've got about 10 minutes left before we start jumping into the question and answers. And I wanted to touch upon some of the information, education that you have about mitochondrial support,
Hmm.
how you deal with that. Because again, mitochondria providing the energy for repair. If they're not working well, you're not going to do much of anything.
Right.
And then I do want to touch on that gut brain axis.
Very
um,
important.
how what we were saying about if you have leaky gut, you're going to have leaky brain. And there's a whole aspect to that, which we've already talked about some of the little biohacks for, especially with BPC 157. But why don't we start off with
Mitochondria.
ATP production mitochondrial support?
Well, as we discussed earlier, the mitochondria is the powerhouse of the cell. So there are two factors. One, the quantity of mitochondria. We can actually increase the number of mitochondria through nitric oxide, PQQ, which is a form of CoQ10, but 100 to 1,000 times stronger, and quercetin, which is readily available. Those three will increase the physical number of mitochondria within every cell, doubling it in 7 days. So, and there are a multitude of benefits of quercetin, five functions on quercetin, PQQ, which is an incredible mitochondriogenesis, which is to make more mitochondria. It increases ATP production. Most of us know about CoQ10. It doesn't increase the number of mitochondria, but it does increase the ability to make more ATP. So understanding that we can increase the number and then we can increase the efficiency of the mitochondria to generate ATP, adenosine triphosphate, which is the molecule that runs every system in our body. So things that will help the mitochondria, B1, B2, as I said, PQQ, CoQ10, quercetin, um,
And
and
something as unsexy as magnesium.
oh,
You got to have a
magnesium,
magnesium
it's a
attached to ATP to
cofactor.
make it bioavailable.
Yeah, it's a cofactor, just
Right.
like CoQ10 helps to bring the phosphorylized creatine into the cells, creatine pyrophosphate. Those people who take creatine monohydrate for exercise, well, it is all about bringing more of phosphate into the mitochondria, the inner chamber, to generate through cytochrome C, generate more ATP. ATP is three phosphates, adenosine three phosphates. So you need to bring it in. So that's what CoQ10 helps. So does PQQ. So mitochondria are the first ones to get knocked down in inflammation. In the brain, all the things like CTE, Parkinson's, Alzheimer's, ALS, MS, Alzheimer's said, they are all lead to mitochondrial dysfunction. And the literature in the past 5 years finally is starting to talk about it. So the key is to repair it, how to repair it. Are the maternal DNA for mitochondria functional? Are, from our mothers, we get very unique DNA that regulates mitochondrial functioning. Do you have an abnormality in that mitochondrial DNA that leads to dysfunction or diminished function? So you get aches and pains. Certain medication, like statin drugs for lowering cholesterol, interrupt the ability of mitochondria to generate ATP. So a lot of people have muscle aches and pains, vitamin D deficiency. If you have muscle aches and pains and you don't know why, and everybody's trying to figure it out, check your vitamin D. because it does. There are what, 618. I just looked at it earlier today for a patient. There are like 618,000 articles talking about vitamin D and mitochondrial and muscle aches and pains. Very
And
important.
about vitamin D, it's like in our DNA 360, we actually look at genes in the vitamin D pathway, which, by the way, vitamin D is a hormone, that,
Thank you.
to say how well someone converts vitamin D, D2 to D3, how well they transport, how well or efficient is their vitamin D receptor. So, again, looking at their blueprint to say, oh, maybe my vitamin D levels are low. Maybe we need to look at your genes and say, where do you need that support? Do you need to
Absolutely.
be supplementing? So yeah, absolutely. Before we
That
jump over to the questions, I wanted to hop over real quick to gut-brain axis.
Okay. The gut is referred to as our second brain, and that is because most people don't know that the neurotransmitter serotonin, 90 to 95% of it is made in the gut. And anything that disrupts the microbiota or the bacteria in the gut can lead to a couple of things. One, loss of serotonin production, so you become depressed. Number two is the bacteria in the gut help to keep the gut P, inflammatory status low. But if their gut is inflamed, ulcer, hyperacidity, whatever, the cytokines that we talked about, the pro-inflammatory cytokines, go right into the blood, right into the brain, and they turn on the brain's cytokine production through the microglia. So it's adding insult to injury. So what we need to do is to make sure the gut is healthy. Now, my daughter Allison and I released a paper earlier this year, which is called The Influence of COVID-19 on the microbiota. Whether vaxes or having the illness, we found the literature talks about the destruction of some of the major bacteria in the gut. If we lose the bacteria in the gut, we become dysbiotic, where we have inflammation, we can't regulate things, our immune system, increased risk for cancers, increased pro-inflammatory cytokines go into the brain. So, what we have in our practice with our veterans, if they're not 50% better in 3 months, we immediately run a GI test to look at their gut and to make sure there's not overgrowth, to make sure their bacteria that should be there are there, make sure there's no virus, parasites, this, that, and the other. And in a lot of our military, because of stress, we find that they're dysbiotic. And my daughter takes care of all that. I don't, that's her area, gut, brain, gut. And she's taught me a lot. She taught me that even though I had no symptoms in my gut, that when she ran this test, there were six bacteria in my gut. And when I treated them with the designated medication, I felt better. I didn't even know that there was something going on. So to say that, oh, I feel great, doesn't imply that there's nothing going on. You just haven't felt it. And the reason why I didn't is because my antibody production in my gut, called IgA, which is a secretory antibody that's in the mucus, it's in the vagina, it's in the gut, in the rectum, and so forth, it protects us. So I was getting protection. My level was higher than it should have been, but I wasn't having the symptoms because I had someone looking out for me, these
Right,
antibodies.
right.
So
Amazing.
check it, check these things.
Definitely. So with that, and I know that you're gonna have more great pearls of wisdom to bestow on everyone, but I want to start jumping into the questions because we do have a lot of fantastic questions.
Okay, is that the
Um,
Q&A thing?
yes, yep.
Okay.
So if you actually click on the Q&A, you can actually bring
Okay.
up those questions and we can kind of uh, go through them. So Michael actually is asking something that we had gone through after he put in the question,
Yeah.
and that was peptides beneficial for use of those with
Right.
neurodegeneration. So just
Yeah,
if you want to just
I can't stress the point, Michael, that before you get on peptides, you need to fix your neuroendocrine and neurosteroid system. Why? Most of us look at testosterone, estrogen, progesterone, and all these things as sex hormones, reproductive hormones. Well, it turns out that every single one of them has a secondary function called pleiotropic, which means many. And what does it do? It drops inflammation. Testosterone drops interleukin 1, 1 beta, 6, and 2 metacrossal factor alpha, and turns on the most important anti-inflammatory cytokine called interleukin 10. So what everyone should consider first is getting their hormones corrected. We run a 28-point biomarker panel. We look at everything. And then we'll add the appropriate uh, peptide specifically to address mitochondrial function like MOTC, or to improve, drop inflammation with things like ARA 290. So there's a whole gamut of things to be done, and it works fairly well. Which blood markers would you recommend to assess neuroinflammation? Well, that's a great question. The standard ones are very expensive. We went through the study on it, which were interleukin IL-6 and 2 metacrossal factor alpha. It's about $360 for those two tests, and you got to repeat it, so it's 720. What we're working with is a genetics company that does mRNA neuroinflammatory markers. And so what we've already proven is that if one of our veterans has a high inflammatory marker and we put them on our protocol, 3 months later, they're all low. So there are markers to help us with neuroinflammation. To give you one specific one, I mean, interleukin 1, 1 beta, 6, and 2 metacrossal factor alpha are 4, but they're very expensive. Probably early next year, we'll have this panel done, and it's very cost effective. Okay, besides checking the root cause of Bell's palsy, any peptides for treatment? That's a great question, because that is part of what we're looking at right now. Is what happens in Bell's palsy or seventh nerve or fifth nerve in tic de la Rue is that the ganglion is inflamed, whether or not it's inflamed from blunt trauma or from infections like Epstein-Barr virus, cytomegalovirus, or a bad infection from a tooth that leaks into the tissue. It causes damage to the neuron, and the neuron needs help to recover. And looking at your health style, your lifestyle, alcohol consumption, eating well, good fluid intake, exercise, meditation, these things help to address the inflammatory chemistry of the body, and you want to drop it. And therefore, things like TB 500, BPC 157, and ARA are very good. But then we're adding to one of our mixes this
Apidolon or
Apidolon,
however.
Apidolon to help. So in the book, there's a chapter which is called Peptides in Combination. And what it does is it has a listing of theoretical, until we get to in practice, do it, theoretical, knowing what the peptides do, biochemistry, molecularly, it gives me confidence to say this should work here. And this is what we're just proving right now. BPC for 8 weeks. Go ahead.
Well, I was just going to say that I wanted to mention to everyone in your questions, we can't give medical advice. So if it is a personal thing, obviously that's outside of the scope of what we're doing here tonight, but he can give general information, educational information.
Right.
So I just wanted to say that.
To answer Marina's question about peptides and pituitary adenoma, absolutely not. What you need to do is define through a MRI with and without contrast and also blood tests to find out if it's the most common ones are prolactin and a growth hormone. Though you can have any of the others. You can have FSH and gonadotropic adenoma, but peptides are not going to do anything. Usually, what's causing it is a chronic stimulation of the pituitary gland. So that would be best. Same with borderline personality, not mental. Well, borderline personality disorder is a little bit outside my venue. Can it be helped by any of the peptides or trauma disorder like PTSD? As I said, I don't believe in PTSD because PTSD and every one of my military, given the title of PTSD, all of them had head trauma. And when we treat them for the head trauma, all their symptoms disappear. It's on my website, tbihelpnow.org. There's an article on comparing TBI and PTSD. I gave it to Georgetown and Walter Reed, the military. It's defining this. FKBPS gene, that's outside my venue. Robin, which hormones do you check post TBI? The most important hormones to check post TBI are growth hormone, LH, testosterone, estradiol, both male and female, because it tells you about this pathway. In our panel, which is called the 28-point biomarker panel, which you can look at on our website under the science, and you can read what's included in it. These are the key 24 measured, 4 calculated peptides, also thyroid, TSH, T3, reverse T3, and it enumerates them. So that's what our ideal. It took 14 years to put together that panel and took 10 years to write the software to analyze it so that other doctors can function with the same joy I have in applying the science, getting the outcome. This all applied to brain inflammation caused by chemical. Yes, great question, Deborah. Some of the things that we miss is we think of head trauma and chronic stress. What about surgery? There's studies done with women who were in sports who broke their femur, their leg bone, and they ended up having a month, 2 months of irregular menses. How's that? The pro-inflammatory cytokines from the leg, like the gut, from the leg, go into the brain and shut off the chemistry of normal menstrual cycle, normal hormone production. And that's what inflammation does. Inflammation disrupts the signaling between one area of the brain called the hypothalamus and the pituitary through a chemical or a hormone, which is called gonadotropic releasing hormone. Okay. Let's see. How do you test which brain peptides you are short of? Well, that's a great question because you're really not short on any peptide in the brain because the peptides are short chains of longer proteins that have unique bioregulatory effect. Okay. It's like in our body, where's the alcohol? Okay. You drink some and it affects you, but you don't make alcohol in your body, generally speaking. Anything for Alzheimer's? Yeah. On our YouTube, we reversed Alzheimer's in a 92-year-old as one. And they are neurodegenerative. One of the fallacies that I talk about, and I think I've got the lecture on one of my sites. One of the issues with neurodegenerative diseases is that the inflammation creates damage through blood vessels through things called beta amyloid and tau protein or NFTs, neurofibril tangles that accumulate around blood vessels and create inflammation that cause mini strokes, micro strokes. And as those micro strokes accumulate, you've got deficits in areas in frontal lobe dementia, in Alzheimer's disease. And what they found in Alzheimer's disease is crazy. Pregnenolone. If you snort pregnenolone, it increases acetylcholine in the opposite side called ipsilateral. If I snort it in the right nares, the left side of the brain increases acetylcholine. Why is that important? Because the literature talks about what's unique in Alzheimer's disease is a loss of acetylcholine, which is a major neurotransmitter. So you can increase it. So what we've been doing is dropping inflammation and giving them the neurosteroids that increase the production of acetylcholine and protect the rest of the brain and the brain-derived neurotrophic factor. The other one is what's the name of the long one that I haven't used is cerebral lysin. Cerebral lysin is, it came from pig. I don't eat pork, so, don't use that. But anyway, what's the name of the peptide that increases telomerase? That is the Epitalon.
Epitalon.
Epitalon. Lon. Yeah, no E, not
Yep.
lone, lon.
Right.
Epitalon.
Lon. Yep.
Yeah, Epitalon. It's really, really impressive stuff. Which peptides are good for knee joint? Well, as I said, that can be taken by mouth. None, to be perfectly honest, David. Um, as I said, I just gave an injection to a doctor. Her knee has on MRI has fraying of the medial meniscus, and because I did orthopedics for 14 years for the state of California, it's very easy for me to shove a needle into a knee joint and pop the combination of BPC 157 and the thymosin into the knee joint. Let's see. Are you able to talk more about companies that distribute the peptides? No, I can't. Can you say if the peptides are from bovine or egg? No, I can't. Okay. The best one that you'll be looking for is the ones that are manufactured here in the United States, which they're starting, and it is using an amino acid sequencer. So they make the product here. The only problem is the amino acids come from China. Until we get our manufacturing of amino acids back in the United States, but they go through the requirements of testing every single amino acid first, building your product, and then testing the whole product after the fact. Autoimmune dermatological, yes, there are. In the book, there are two. My daughter, Erin, who's in dermatology as aesthetic medicine, MD, she has, I think, two or three of the chapters where she talks about that, the autoimmune. Okay. And on my website, tbihelpnow.org, go to Biohack Yourself, and you can see an example, a sample of, excuse me, each of the books. It's all free. Okay. Vanessa, do you have experience using? No, I don't. But yes, allopregnanolone was developed 10 years ago as brexanolone by a company. They call it Zulresso. Zulresso is allopregnanolone under a different name to confabulate and to make people confused. Allopregnanolone is important for antidepressant, anti-anxiety. It increases the production of GABA, and it helps with inflammation in the brain. And the way that we get that is by using pregnenolone, which converts to allopregnanolone, $80 a year versus $34,000 a year. Okay. And we have thousands of patients that are on it, active patients that are on it. Let's see, this thing keeps on skipping, so it's telling me to move faster, I guess. Let's see, in the case of chronic multi-area stress, are you proposing that healing can be supported? Does that include emotional stress? Emotional stress, is usually environmental. You need to fix the environment that you're in. Can you be more sensitized towards, more sensitive towards things that normally would not cause stress in people? Yeah. That's how you respond to it. If your hormones are off, like we see, I'm working with a 57-year-old woman who 5 years ago developed panic attacks in the emergency room every week or two with complaints of shortness of breath, chest pain, headaches, dizziness, high blood pressure. It turns out it's her hormone deficiency. So you need to have your hormones, and correcting her hormones disappeared. 5 years it took her to look for something outside the conventional wisdom of standard traditional medicine. Okay. This is my first time to hear about peptides. I see them in collagen as hydrolyzed peptides. What's the difference? Um, Collagen is a longer protein sequence, amino acid sequence, um, hydrolyzed as hydrolyzed peptides. That's collagen. Just call it collagen. Peptides are these other things, epithon, um, BCP, OS11, PNC27. They're specific peptides, not collagen. Collagen is structural. Okay. Are these peptides addressed as a transfer factor? No. I haven't seen that they actually transfer anything, except maybe one, PNC27, which actually in cells that are cancerous, there's a change in the membrane, and this PNC 27 looks for this change in the membrane and takes advantage of it and transfers a code into it to cause the membrane to open up and kills the cell. So through PNC 27, it can help with cancer. What kind of peptide recommended for menopause protection to prevent cardiovascular disease? Just your regular hormones. On my website, because of a similar question 2 months ago, I think the paper was October. It's perimenopausal women. Uh, Perimenopausal women are being mistreated, not treated, because the industry is saying, well, you shouldn't give hormones to a woman in pre or postmenopausal state until they're symptomatic. That's like driving your Porsche into a wall at 60 miles an hour and then putting your seatbelt on. We need to be proactive. We need to be interventional. We need to know that these, in the science, it says that if a woman is deficient in estradiol, that she has a 50% increased risk of developing dementia, whether it's Alzheimer's or whatever. So what? We're going to wait? But that's what some of the industries for women are stating. And they're also stating that there's all the hormones you need already being produced. You don't need compounded hormones. That's a load of stuff. Okay. We're unique. The amount of testosterone I need, I don't take testosterone, but the amount of testosterone I did need was very little because my biophysiology, my genetics, my DNA said I don't need a lot because I use it efficiently. But I have people who don't. So you have to figure out what it is for you with a doctor who really cares about what they're doing. Okay. Is there a best peptide for Alzheimer's? The one they talk about is cerebrolysin. That's the one that gets a lot of press on Alzheimer's. But what we found is correcting their hormones is key. And then you can add onto it, cerebrolysin or N-acetyl C-Max to it and to help. Now, what we found is another protein. I just gave a lecture on Alzheimer's disease, the modern view of it. 65 years of age and older is where Alzheimer's occurring. And what we're finding is a enzyme called delta secretase, secratase, delta secretase. And it turns out that delta secretase is increased in people with head trauma and in the aging process. Okay. So delta secretase is what creates the beta amyloid. And the beta amyloid gets the tau protein, the NFTs, neurofibrotangles. And that's the problem. And with it comes a large amount of inflammation. And what causes the hyperphosphorylated, hyper, excessive phosphate hooking up to the tau protein helps the tubules in our neurons to stay together. And when you phosphorylize the tau protein, it disrupts the tubule, so you cannot transport neurotransmitters from one end to another, acetylcholine as being one of the key ones. It shows your ebook, Peptides Felt, are sold out on your website. Well, if you read what it says, it won't be available until December 22nd. Okay. And that's when it will be loaded into the website as an ebook. There's a discount code that's already there. You purchase it, it gets downloaded to you in PDF format, and it has links to over 360 references. So if you're like me, when I read an article, I see a part that I like, I go and read the key article that the authors use for that one little part because it gives me more information. I spend maybe 5 hours a day reading, and that's where I'm not an expert in anything, but I am definitely well read in what I'm doing. Okay, so oh, what is it?
Yeah, we have another question. Are peptides useful for autoimmune dermatological conditions?
Yeah, I answered that. There is,
Yeah.
let me see where my cheat sheet has it from my daughter. Um, there's one specifically for dermatological, let's see. Skin remodeling, wound healing, secondary. Yeah, GSKCU is a good one for the dermis. helps with the dermis, but there's another one which is
Now they
much
have
deeper.
that the GHKCU. They have that in topical form as well. Is that what you're talking about, or more of the injectable?
No, you can use topical like for hair or if you have a scar. The project that we have right now is we're using a 24 gold pin delivery system on the scalp.
Okay.
Okay. And
Mhm.
we're doing that Monday, Wednesday, and Friday for 3 months. Okay. To see what the response is. Let's see. Yeah, KPV is a three amino acid, lysine, proline, and valine. Its primary function is on the gut, but it has a secondary effect on dermatitis repair, so inflammation of the skin. And there's another one. That's one. I think she gave me three. And um, let's see. Me- Photodermatitis is one. That's not it. Okay. That's basically it. Tissue
And
repair. Okay. I
I
think
would want to
that's it.
interject that, when you have an incitement of a skin condition, unless you are actually born with it, which generally that's not the case, it's finding out what is that triggering factor. What are the antecedents that
Right.
created and caused that dermatological condition to come forth? Because yes, the peptides can help, but it's it's almost like a bit of a band-aid. You have to address that root cause condition, and knowing
Absolutely.
your genetics can definitely give you support and information on why, but also finding out what you're sensitive to in your environment. What did you ingest? What were you exposed to? Is it weather? Is it mold toxins? Is it, what is it? Because that terrain needs to be cleaned up for you to not have to deal with that condition on any type of long-term basis. And it's not like these peptides that you should be on it for a long, indefinite period of time. Like Dr. Gordon, like you were saying, these are structured in a therapeutic way for a certain period of time, and several of them are meant to be pulsed. Like epitalin, you only take that for, I think, like 10 days every, either 6 months or a year. I mean, it's very specific when you're talking about these protocols.
Mhm.
So
Absolutely. Yeah, it's called OS01. One skin, cutaneous senescence barrier dysfunction. What it's been shown to do is help repair the skin, take away lines, wrinkles, reinvigorate it. So it takes it from the senescence, age related, to a more youthful. And I think in combination, which is probably what my daughter Erin will do, is a combination of GSK with the OS1, which is a topical preparation. Rub it in.
nice.
Okay. And it's not a
So,
steroid.
and that's good, because I mean, really, when you start perturbing the hormone system, I mean, obviously, like you've been saying throughout, knowing what your hormones are, looking at the balance, if they are perturbed in some way or if they are imbalanced, to make sure you address that. But you don't want to have a lot of other, xenoestrogens or other compounds that are further disrupting that hormone balance, because then you're just muddying the waters again and making it more difficult for that healing to occur. So
Absolutely.
wow. So the last hour and a half really flew by, and with such fantastic information. This has been absolutely wonderful. And I wanted to ask you, is there any last pearl of wisdom, anything that we didn't cover that you want to make sure that our audience is aware of?
Mm, I think we went through everything, but the final lines are in order for any of the peptides to work optimally, you need to have stabilization, homeostasis of your hormonal milieu throughout your body. These peptides are powerful tools you need to have someone to guide you to use them. The book is not a guide. There's a lot of disclaimers in it because we're not here to treat you. We're here to educate you so you can go back to a doctor, hopefully that knows, and to discuss with them about it. If they're not the right one for it, find someone else. There are a lot of doctors who are coming out of the woodwork to specialize in peptide sciences, okay, to deliver it. And, beyond that, reassess, your history. Did you have a difficult birth? Did you have any motor vehicle accidents? You still have residual inflammation going on that can last, according to the literature, 17 plus years. 17 years ago, you could have had a slip and fall. And you think now, well, I'm fine, but you recognize cognition's off. You're not doing what you really like. You're not as happy. Might have a little bit of blue, a feeling of blue, instead of saying depression, feeling a little off and so forth, not as spunky, not as energetic, not as energy laden, fatiguing early, libido's off, you just don't care. Reassess where you've come from. And remember, lifestyle plays a major role in helping you to move forward. Alcohol, horrible. Drugs, horrible.
Well,
I'll have a drink after this, please.
a
My
drink of
I,
water.
my hydrogenated Echo water.
There you go. Perfect. Well, again, thank you so much, Dr. Gordon, for your
Always my
brilliance,
pleasure.
your very well-read brain of information. We will definitely be looking out for both editions of the book
Right.
for clinicians and for consumers. So we've got information in the chat on where to go to get that. And thank you, everyone, for joining us. We hope you are walking away from this webinar with the information you are hoping to gain. And have a wonderful, wonderful Thanksgiving for all of you in the States. It is this coming Thursday, so we want you to be safe. We want you to not drink alcohol. But if you do, be
Celebrate.
responsible.
Yeah.
Yes, enjoy.
Celebrate. Absolutely.
Enjoy your family.
Absolutely. Thank you. Thank you all very much.